Let's talk about lipoprotein A today. So, what is a lipoprotein A? Lipoprotein itself means lipo means fat and protein is a protein. So, basically, a component which carries your cholesterol to your blood vessels, right? So, you must have heard about LDL, HDL, basic things from the lipid profile. LDL is low density lipoprotein, HDL is high density lipoprotein. These are the common tests which we do in lipid profile. You must have got this done several times, right? But lipoprotein A, that's a stickier form of lipoprotein. It is a different form of LDL, you can say. In people who are having high LDL in spite of all the other things, this is the best test recommended. Lipoprotein A is a genetic determined thing. So the blood levels of your body would remain almost stable. So it's a genetic aspect. So it is formed genetically. So it's a once a lifetime kind of a test. So it's a simple blood test. Best option is the fasting samples. Even if it is not fasting, you can get the test. It is very simple blood, like other normal tests which we do. But it is not a part of your routine lipid profile. Why? Because it does not really vary. In children above 5 and above, usually lipoprotein A level rises to almost the adult levels. So that complies, that informs us that's the once a lifetime. Why do we need that only once? Because it doesn't change, and it is also genetically determined. So what does it do? So when after testing lipoprotein A levels, if they are high, high means more than 30 mg per deciliter depending upon the kit used. You can interpret that according to the reports you are given. We can interpret or we can see there is a high risk of developing heart disease prematurely, that is around 45 years of age, or there is a high risk of stroke, or people with family history of hyperlipidemia or high cholesterol or high lipid profile. In those people, it can predict initial chances or high risk chances of cardiovascular events. So it is wonderful test to check if you are into the high risk. So what if it comes high? So in those cases, you need to take medicines to control your LDL. You need to quit smoking, quit alcohol. If you are overweight, reduce that weight. If you are stressed, change that pattern. Eat healthy regularly, cut down on your fatty foods and all the even non-veg food has to be in limit. So you have to check your diet and you have to check your lifestyle. And these can only help in a certain amount of maintenance. But if